And we'll get started. Good evening, everybody. I am Dr. Mark DeBrincat, the Good News Doctor, and I'm excited tonight to share with you my journey with ASEA and how these redox molecules have made such a huge impact in my practice. Now, I am a chiropractor by trade for 30 years, and I specialize in brain and spinal trauma. I've always been very fascinated with the brain, and since I've learned about ASEA 10 years ago now, this next month is our 10-year anniversary, it has absolutely catapulted the results that we get with patients that are seeking to return their brain health, to regrow tissues in their brain, to optimize their brain's output and return themselves to a younger, healthier version of themselves. And it seems like these redox molecules has absolutely given them wings to just soar. And prior to redox, we used to do treatments and then wait, wait for the body to catch up. And then we would treat again and then wait for the body to catch up. And it seemed like a lot of waiting. And now it's like we can just keep going and going and going. And like a little energizing bunny, it allows patients to break free of limitations neurologically, physically, chemically, emotionally, spiritually, even as people's brains come back online. Now, you could be treating symptoms all throughout your body and wonder why you just don't keep getting better and why you plateau. And then all of a sudden you look at your brain, it's like, oh, well, that's why. We can address a few issues and then right back like your younger, youthful, happier, more vibrant self. So I put together a little presentation. I have been um, for a profession doing clinical studies and trials on all different types of products and technologies throughout my career. And so I have done a few with ASEA over the last few years. And so I'm going to first explain what it is to preserve our brain health, what redox role is in our brain health and our brain function. And then I'm going to show you how we can assess and look at the brain to determine really how much damage is there, how long is it going to take to restore normal function. And then I'll end with sharing you my results from two different studies. One was with 60 people started the study and 55 ended it over a 90-day period, never been exposed to redox before. So let me just make this disclaimer. Both of these studies that you're about to see were done on people that have never been exposed to the supplement. And so in those first 90 days, they have much greater gain, and you don't keep having the same amount of gain every single 90 days. Otherwise, we'd all have 180 IQ and be brilliant. And so there definitely is a plateau to some extent once you reach your youthful selves, like you're going to get better, better, and better. We want to be able to maintain that youthfulness at that level. So, these experiences that people had in those first 90 days, as you know, 90% of the people find a breakthrough within those 90 days. And we can track it back to what part of the brain really had the biggest breakthrough and what that looks like in yourselves and in your body. So let me go ahead and start by sharing our screen. And we're going to talk about what it takes to preserve your brain health. This is truly the key to unlocking the full potential, not just in your brain, but in your nervous system and in your entire body. Now, not only am I a chiropractor who specializes in brain injuries and brain recovery and spinal, I had to also become my own best patient, unfortunately. My wife and I were in a head on collision and had massive injuries that left me permanently disabled for a lot of years. 17 years it took me to finally crack the code and get my abilities back. And that's been going on 11 years now, right after right? The same year that I found ASEA was the same year I broke free of my wheelchair, medications, and the limitations that had been on me for so very long. So I absolutely had an amazing experience with it personally, and then started seeing what it was doing in the brain and was just absolutely blown away. And it cascaded into this. Now I've helped thousands of people all around the world not just understand brain health better, but be able to do things to impact the brain and help the brain, even though we're not face to face and using my physical technologies that we have. It's that redox potential that gives us the ability to truly help people anywhere on the planet. Now, when we look at the brain, there's two different compositions. I'm going to give you a quick little education on how the brain fires and functions. The image on the left is your cortex. That's the outer shell of your brain, like a melon. This is processing about 2,000 bits of data a second, and it's everything that you think your brain is. It's how you experience your life. It's what you think, say, feel, do. It's how you experience. You think it's your full brain, but this part of the brain, every little crumb of brain tissue there is processing about 2,000 bits of data per second. When we look into the white matter below, the core of our brain, now it's processing 400 million bits of data per second, and we don't even have to control it. It's all subconscious and unconscious. So it's an amazing instrument computer that we have within our skull that is faster than any superhuman computer on the planet. And we are not even tapping into a little bit of its potential. So, how does the brain work? Well, it's all about the synapses. Okay. We're using nerves to send molecules in between the junctions of the nerves, and those molecules are called redox signaling molecules. They're cleaning up the receptor sites and they're carrying those neurotransmitters across that nerve. So we're truly dependent on redox to play that role to get the message across that synapse. Now, where do these redox molecules originate from? Well, the good thing is we make them. We make them in every single type of cell in your body by these little mitochondria that looks like a bean. It's producing molecules of bioidentical or molecules that are energy to fuel and charge the power of our cells and then signal throughout our body so they can talk to each other. It's the language of our body's cells and how they talk. So before we get into really understanding how we evaluate the brain, I want to go a little bit deeper on what are the two main things that we see cause the most havoc in the brain or the most cognitive decline and issues with our overall brain health. And so there's two conditions we're going to talk about. The first one is called the general adaptation syndrome, or it's referred to as GAS. Some of you might know that as brain on fire. People are just wide open. You got so much on your plate, you don't know how to slow down, and you just go, 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 and you adapt. Well, here's the thing. Your organs are supposed to send you signals on when it's time to rest and slow down. And when we don't listen to that signal, it gets tired of telling you, so it stops signaling you. And then it says, okay, well, Mark says we all need to run, so there's no rest anymore. Everybody, come on. The new program is run. And so you stay running, running, running wide open. So there's three stages to this. There's an alarm reaction. Your body's saying, hey, slow down. There's the resistance saying, I can't. I have too much debt. I got too much. I have to work. I can't take a day off. I'll get more behind. And then there's the exhaustion phase. You just continue to go wide open until your body just gives out and shuts down. And that is called running out of gas. Now, the typical cause of this is stress and how we're managing this stress and basically failure to slow down. Okay, failure to listen to your body's signaling that's telling you there's a problem and you fail to listen to that and you don't slow down and then you run out of gas. Now, this gas is considered the process. It's the step-by-step process of how your body handles and reacts to stress. Now, the other thing we're going to talk about is called an allostatic load. Okay, this is basically the accumulation of wear and tear on your body. How much stress is continuing to happen. Now, a stressful event should be over shortly. If it's followed by another one, it causes more load on your body, more wear and tear, and typically it lasts longer. Okay, and that cortisol can be very disruption. So frequently activations of stress over and over and over again continues to build up a higher load of the stress that you're bearing. And then failure to turn it off when it's done keeps that stress going for a long time. And you're prolonging the cortisol release, which is that stressful hormone, and it's inhibiting your body to have the adequate response of dealing with it and turning it off. Okay, so the inadequate response means the systems don't activate properly and don't let go of that load properly. And so the beautiful thing is redox signaling molecules will reverse the load. There was a recent study that they just talked about at this last convention that we were at on how over time with the redox molecules, the outcome is going to be less allosteric load. And so think of this load as the outcome. It's the price your body pays for holding on to stress and bearing it. And it's easy to say, hey, just let go of the stress. Don't let it bother you. Like, oh, why didn't I think of that? It's just not that easy. It's because we're lacking potential to deal with the stress. So, well, what's potential? Cellular potential is the amount of charge we hold on our cells. We either have a charge or we don't. And if you have a charge, guess what? Your body will maintain health and maintain function and vitality. And when you lose that charge, not a whole lot going on to defend itself. Okay. And the problem is the more symptoms we have and the more stress we hold, the more of a charge of our battery is stolen from us. And then, not to mention the fact that as we age, we don't produce as much redox molecules. So, as we're young, we have more than our body needs because we're doubling in size every 3 months or every 6 months for 3 years. We're doubling in size when you're a newborn. So, we have so much extra to fuel that potential and that growth. And then we get into our mid 20s and it starts to drop off. And so by the time we're 70 to 90, we're making, 10 to 30% of what we used to make in our 20s. So we don't even have enough fuel to run the cells the whole day without losing our charge. So think of this like the fuel for the battery that allows it to have potential. And as you have a recyclable battery over time, it just never charges as much. So the thing is when we're older, we need more than we did when we were younger, and we have less. So that is the problem. Add on to that the stress we bear and not being able to let go of the stress and not being able to slow down. We're setting ourselves up for early disaster and cognitive decline. So when we're young, our little mitochondria are so happy they're spinning out all sorts of redox molecules and energy for us. But then as we age, it's like, well, I can do like this much. I got a little for you. I don't have as much. I'm doing the best I can. You just kind of deal with what I can give you. That's all I can make at this time. So here's the key. We want to be able to make more, and we can't necessarily make more. We could for a short window when I have more healing to do, but we can't stay wide open or we're going to run out of gas. So, how do we look at the brain? How do we evaluate your brain to even know that you have a problem with this quote potential in our brain cells and in our brain tissue? And we do several different scans and kind of put them all together to create a wonderful picture for you. Now, the first thing is we want to make sure that you don't have hearing loss. So it begins with the full hearing test because hearing loss leads to cognitive decline. You can pretend that you're ignoring it, and I'm going to say, oh, I don't have hearing loss. Guess what? When you first have hearing loss, your brain fills in what you don't hear. So, in essence, you are hearing it, but you had to borrow resources and fill in that spot. So, it will lead to cognitive decline. And by the time you figure it out, it may be too late. When we find it early, we can actually treat it. So after the cognitive test, after the hearing test, we do what's called a full precognitive assessment. We can find dementia and cognitive decline up to 15 years out before it becomes a severe problem for you. And not only that, we can pinpoint exactly where it is happening. So this is like going into your brain and taking it for a test drive and putting stresses on your brain and seeing how you respond subconsciously. Remember, this is in the white matter that you have no control over. So when you hear a noise, you're looking for a specific noise to hit a button saying that's the noise, and how fast can I hit it? And am I accurately hitting it for the right noise? So the language center in your brain lights up. It says, oh, that was a noise. It then sends it to the frontal cortex that just says, okay, we need to decide, what do we do with this? If it's this is for attention and memory. And now if it's an inhibitory saying, don't hit it, it's the wrong noise, then that goes to a certain part of the brain that lights up and says, stop, don't do it. Or it might go to an oddball sound that associates it with that. Or it's going to be the appropriate tone and you go right to that motor cortex and you hit it. So you may have a couple that's maybe in denial. One person thinks they don't have dementia, and the other spouse says, oh, you have it, and I don't even want to get in the car with you if you're driving, but yet they're in odds with each other. I've had to be the referee more than once in this situation, and this test allows us to see how much amplitude did it take to light up each area, how long did it take to complete the job, and how much energy did it take to complete the job. So then we can see in this case, the 3 green on the top, all the motor skills were 100%. So he was physically fine. But there's 21 metrics in here that can show me you're already in dementia and it's causing too much time to get these processes done. And you're borrowing too much energy from too many places. You have no spare reaction time, no reflex time, and you're putting yourself at risk because there's not going to be time to react quickly to anything. You're exhausting all your energy. And they immediately realize, wow, maybe I shouldn't be driving. That makes sense. And so it's not bad news. The good news is we know how we can help this. And having redox potential improved is the very first step to make all of this happen. We can do aggressive therapies and biohacks and other different tools that we have to accentuate this and make it happen faster. But inevitably, we now have a means to be able to track and monitor progress. We also do the full EEG, QEEG, which allows us to build the whole 3D replica of the exact brain's neurology. And I can say what each little cell in your brain is doing or not doing, okay, and how much potential, how much battery charge do these tissues hold. So with all that wonderful information, we had, as I mentioned, done a couple different tests with the SIA. I was so curious because I've always added it to all the therapies we've done, and it just doubled everything. We got there twice as fast. We were no longer waiting for the brain to catch up. We could keep pushing and pushing and pushing and never hit a wall. It was just absolutely unbelievable. But in all of these 10 years, I never did a study where I wouldn't let anybody do any therapies, no other nutritional products, no new anything for 90 days. And then during that time, they were drinking 8 ounces a day and rubbing the Renew 28 on the front of their neck morning and night. And the results were nothing short of astonishing. Um, we would see changes after 20 hours of neurofeedback training to be around 10 to 25% of improvement in the overall neurology of the brain. And with ASEA, it was 52% as an average between the entire group of 55 people that finished the test. 5 were disqualified, they had an injury, they needed to do therapy that would have skewed the results of the test. So out of 55 people, I've never seen these numbers this high to have this kind of positive change in the neurology. And it wasn't like it knew where to go, like each person knew where they were putting it. They just had to get it in them. And honestly, now that I've really studied the gut in more detail with redox, we understand now that it's actually helping the gut first, which is calming down the brain. Okay, I was always thinking the majority of it was going to the brain, but I had to kind of change my viewpoint on that after studying the gut, realizing that, oh, this is just a mirror of what's going on in the gut. So it's impossible to have a healthy brain if you have a really unhealthy gut. But the beautiful thing is redox does everything to bring potential and balance back to the microbiome and to the signaling of the nerves back and forth from your brain to your gut and the immune response and the detox. So every part of that is a redox function. So when we do these maps of the QEEG, we can literally see trauma. So this is the right and left brain of somebody, and they fell backwards and hit their head. So the red spot is usually the impact. You're seeing the right side on the left of the screen and the left side on the right. The nose is in the middle there. So these are two lateral views. And the brain got hit in the back. It bounced off the front of the brain and went right back to the point of impact. So it's usually the second impact where it rebounds that those two tissues come back at different speeds and cause a lot of damage. And so there's disconnect. And think of the blue like oxidative stress and slow potential. There's lag in those nerves firing. And the reds and yellows is inflammation, too much activity, too much bombarding of those nerve signals. That's not healthy either. So when we look at a mean, it's the whole group of 55. This is all that they had an average, mostly yellow, which is two deviations too fast. And at the end of it all, it as a group, all of their brains in those same areas turned mostly green, which is two deviation difference, which is again an amazing result. And then we had a study that we've done on the Redox Gold. This was very curious. I knew right away from using it myself and the 2 minutes it took to make the tingling and pain or discomfort, excruciating discomfort in my limbs, basically calm right down. And then I didn't have to put any on, and it literally lasted 3.5 days. I'm good for about 12 hours. Nothing's ever lasted that long. So this was astonishing. And I said, you know what? They're targeting this for discomfort relief, muscle relaxing, and recovery. It is a far more effective brain tool than the redox that we've been using. Now, it doesn't replace it. You know, if you stop drinking it like I tried for a few days, the whole tide slowed down, and then I couldn't even get out of pain. So you really need to have primary is drink. Okay. I would say 8 ounces a day is the average minimum that I have most of my patients on and above. Okay. You can't actually take too much. If you do, it just converts back to saline, okay, in your body. So, with that, this was astonishing. We would take a pea size of the Renew Gold, place it right at the top of our neck in the soft spot before the skull, and rub up into your skull for just a minute. And we would remap these brains in 15 minutes. And it's always easy to calm down a brain. Okay. And the Renew Gel does a wonderful job at that. And to see something bring the potential back in and raise up a brain that's super oxidative stress, that's got slow potential, low potential, it's much more unusual. That was exactly what this does. It's an adaptogen. So if it's a blue brain like this, we see it immediately come back to homeostasis within 15 minutes. I've seen brains that were on fire, all red and yellow, and they calmed down to green within 15 minutes. Well, how did the gold know to do that? It's targeting a single pathway that deals with oxidative stress or inflammation. Guess what? That's the two ends of the spectrum. So by activating that gene and helping your own body's cells identify, detect, and correct the issues within those cells faster, we were able to go down that one pathway and have incredible results. Now I can only imagine how much more we can push the brain because I don't have to take the entire keyboard and raise the whole piano. I just got to take one key, okay? And that one key is going to have a massive effect on this type of reaction in the body, neurological homeostasis. Now, here's another image where we look at the inside of the brain. And this image is very disruptive. The image on the left for information flow should be no lines at all. But if there are going to be any lines, they should be yellow, yellow or red. They should be too fast, okay, typically. To see blue and red in this same image means that this is a serious traumatic brain injury patient. So they've had a concussion and it's absolutely not healed yet. So they have good days, good times of the day, bad times of the day, a lot of inconsistencies. A little dab of gold, and in 15 minutes, it not only brought it to the right color, mostly yellow there, but the fewer the lines, the healthier the brain. This is truly amazing to see that much change. That is equivalent to about 120 hours of neurofeedback. Now, the difference is the hours of neurofeedback would make that a permanent change. This lasts about 3 to 6 hours for that person. But repetitive use twice a day on that brainstem over time could actually allow the potential to be restored and be able to hold this effect. The fact that it can change like this so quickly is truly amazing. Then there's another aspect where we actually have the patient focus on an inanimate object for 5 minutes and don't look around the room, don't think about anything, just stare right at that part of the object and don't move your eyes. And in this generation, in this season of existence, most people can't do that easily. Okay, they're so used to quick, 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 swipe, 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 short burst of dopamine to stare at something that nothing is happening. They get very frustrated. And a lot of times, the image on the right would be worse than the image on the left, like a lot worse, because that was a difficult task for them to do. Their ability to focus and clear out the lines was almost perfect. That should be exactly what happens. It might be a little bit of fuzziness in there or overexcitement of some nerves causing a little inflammation. But when at will and they put their attention and focus into something, they were able to dial it right in. Now, without the gold, you would need, again, 100 hours of neurofeedback to be able to do that sustainably and easy and effortlessly. So again, we used to wait and wait and wait to be able to see results. Now we see it instantly, and it's just a matter of how long does it last. We have to treat it one more time and keep the brain at homeostasis as much of the day as possible. So here's the mean of the entire group of gold people. What they all had in common was a little delay through that central part of the brain that connects the right to left brain. That was a common feature that they all had. And at the end of 15 minutes, most of all of that was clear. Again, it's astonishing to see that. And then the other thing is when we look at all these purple dots, these are what are called Brodmann areas. And we have over 250 networks in the brain that make up these areas. And think of the dot as like if it was a state, like this is a map of Brodmann areas. You have 88 on each side of the brain. They all control very specific functions in your body, whatever that is. So to see all of them turned on and to have a hot mess of lines, and then 15 minutes later, to see it all clear up, it makes me so happy. I get so excited because, again, this is like months of therapy for some people to be able to accomplish that, and we can do it so quickly. So, as I mentioned, there's a few hundred networks in the brain. Anxiety network means if all of these dots were like a group text with you and all your friends, and you put out a message and you just thought everybody got it, but certain people blocked other people, and so that message didn't get to everybody. The more blockage there is and the more lines you see on the screen, that means the more symptoms in that network you're going to experience. So for anxiety, for instance, even though this is not treating anxiety, this treats inflammation and oxidation. And those are things that build up for you to actually start having symptoms of anxiety. So we can see that network falls down very nicely. So what does resilience look like in you? This is a question that I've asked myself for a long time, and I've created this slide to really help kind of paint the picture. So we start each morning and our body's got a full glass of redox. We have good potential for the whole day. And our batteries are all charged. Okay, that's the other output of the mitochondria is ATP to charge our cells and redox to keep all the signaling and everything happen. Well, early in the morning, you got a stressful event happen, pulls you out of homeostasis, out of that beautiful center where everything's thriving and your body can just focus on healing the body and not dealing with the injuries. And then unfortunately, another one comes and pulls you in the opposite direction before you got to bring yourself back down and let it all go. And then the way we all live is you can never expect when the next stress happens and it pulls us further away from neutral and further away from neutral. And all that means is we have a lot further way to go to get home. So what does it mean? When we're further away from home, it requires more redox to get back. And when we're further away from home, the pH in our body is pulled away from neutral too far and it drains our battery very quickly, like having your cell phone out in the cold. And I had a full battery 5 minutes ago, now it's dead. Okay. So we're making these molecules all day long, and we have choices that we're making all day long. So if you have this much redox at the beginning of the day, and you have all these things to do between now and the end of the day, how are you using your redox? Some people might have a poor diet for breakfast. That cost you redox, didn't build it for you. And then you got to have lunch, and it was another poor choice that cost you more redox to break it down than you made from the meal. And then you got home, and on the way home, you had some road rage, which just depleted you of any reserves you have. So, like, really, what's left when you get home? Very little. And now you need to go sleep and repair and heal your body, and you have very little. Now, that same person might make different choices. You might have protein for breakfast that's easy to metabolize and actually make energy from that. And other actual plants, fruits, and vegetables, and things that grew from the ground that were alive at one point that help you make more redox. And now you keep filling your cup up. You get home, take a nice bike ride, watch the sunset. You end up with more reserve at the end of the day. So here's the question: are you adding or are you taking away with the choices that you make all day long? Now, when plan A is like, okay, well, I'm just going to do all the right choices and be perfect. And then it ends up being, well, deviate a little bit here and there, but I just got to stay on course. But the reality, all of our lives are crazy. You can't predict that real life is going to cause you to need so much more of these resources than you planned on, and you unfortunately run out of gas. So what's left over at the end of the day? How many of these molecules do you have to go into the healing part of your night? Do you have enough left over for that? How about when you're sick or you're injured? It requires a whole bunch more. Do you have any reserve for that? It's like having no savings account and living day to day, paycheck to paycheck. Well, what if you were given extra redox? What if that actually could happen? You can't make more mitochondria, so you're not going to do it that way. But if you were given a whole extra glass, like back when you were in your 20s, that's exactly what our supplement will do for you. I'm not going to tell you where it's going to go and what it's going to do in you, but I do know it's going to bring potential to your cells, and your nervous system knows exactly where to go, what to do. It's got a priority list, and it's used almost immediately. So, quite frankly, it's reckless not to be supplementing with this. Why would you want to use the little bit that you have to fight the crazy stresses that you're dealing with all day long and have nothing left to get you into homeostasis and have your body go on this rapid decline of your health? Well, the good news is ASEA has made these molecules, the same exact molecules, high energy, tiny molecules, bioidentical to the ones coming out of your mitochondria. So that's ASEA. This is the world's only one that you'll ever find. They have 7 patents and over 7,000 trade secrets to protect that formula. It's native to the body, which means our body makes it, doesn't have to assimilate it, break it down, and figure out what to do. It just says, what are you doing here? You're supposed to be over there. And immediately brings it to the area that your nervous system needs. Supplementing with these redox molecules increases the redox chemistry. It raises the tide of all cells, which means battery power and signaling power, both super important for your nervous system to communicate. It helps us improve our body's ability to maintain that homeostasis. How resilient can you get back home every time a stress starts coming in to your body? How happy are your mitochondria right now? You start drinking these molecules and you're going to see they're doing a happy dance. They're like, I don't have to work as hard. Wow, we have all this potential. It's actually giving me energy and helping me make more as well. What a concept. It brings out the best inner you for sure. So, making the world a better place, one brain at a time, one cell at a time, one body at a time. We absolutely love and appreciate this company and what they've done to protect it and to make sure that it didn't just get shelved and nobody ever heard about it. They could have easily gone that route, but they care too much about humanity, and we all do, and we want to make that difference. So, this is not a company that's here trying to diagnose, treat, or cure any conditions or diseases. It's not about that. We're all about improving the potential of the human body. It's up to you to make the better choices to preserve that, to be able to live a longer, healthy life and truly thrive throughout your life. Or you can ignore the signs, run out of gas, have all sorts of health crisis at a very young age. We're living at a time that is unprecedented to any other time in existence. Our grandparents and great grandparents never had the kind of stresses that we deal with on a daily basis and hold on to. Things that we're exposed to, chemicals and pollution that's never existed before now. We cannot live without restoring potential, or at least not live well. And so hopefully this enlightens you a little bit and got you to understand how important the brain is. And oh my gosh, technology has grown so much over the years that we have the ability to tap into this strength of our brain, dial it where we need to be, and be able to track that progress all along the way. And it is such a beautiful thing. All healing begins inside the cell. Everything that's ever harmed you or hurt you came from outside of you into you and caused havoc. This is a molecule that gets back to the inside of your cells and where the healing begins. There's no further upstream you can go to start the healing process than what your body actually does. In every instance, it's creating more potential to fuel whatever reactions and processes need to happen to bring that part of your body back to homeostasis or heal it from being injured or prevent it from dying or actually kill it and create a new cell because this one is past the point of no return. So if you like this information, please feel free to share it with somebody that you think would also benefit from learning how to restore our potential and grow old with all sorts of vigor and excitement and enthusiasm and energy and activity, being able to do things. The biggest thing that's going to cause somebody to start declining is loneliness. It's staying inside, not meeting people, not being social, and not feeling like you even want to. All of those are signs of low potential. So if you care about somebody enough, just make sure they don't have to understand how it works. They just have to take it. If they understand it, they're more likely to keep taking it and realize that this is my alpha supplement. There is nothing else that I would give up before I had to give either of the Redox products up that were so blessed to be able to have access to every day. This will make every other therapy you do enhanced and receive it better. This will make all the other supplements and the food that you're eating be able to be received better and get more out of it. In any aspect of how I test these molecules for all types of looking at the body through objective testing, it hands down is impossible for it not to work because this is how your body makes these to heal itself from the very beginning. So